Did you know that many people don't get the full benefit from their inhaler because they use it incorrectly? Even a small mistake can mean less medicine reaches your lungs. In this video, I'll show you the correct inhaler technique and the most common mistakes to avoid. Inhalers deliver medicine directly to your lungs, helping you breathe more easily if you have asthma or chronic obstructive pulmonary disease. There are different inhalers, including metered dose inhalers and dry powder inhalers. Always check your inhaler's instructions before using it. Remove the cap and inspect the mouthpiece. Shake the inhaler well if your inhaler requires shaking. Before using the inhaler, breathe out completely. Hold the inhaler upright and place the mouthpiece between your lips. Press the inhaler once while breathing in slowly and deeply. Hold your breath for about 10 seconds if possible. Then breathe out gently. If another puff is prescribed, wait about 30 to 60 seconds. If you're using a steroid inhaler, rinse your mouth afterward. One common mistake is forgetting to shake the inhaler. Breathing in too quickly reduces medicine delivery. Pressing before or after breathing in is another common mistake. A spacer can make inhalers easier to use. Keep your inhaler clean according to the manufacturer's instructions. Check your inhaler's dose counter so you don't run out unexpectedly. If your inhaler isn't relieving symptoms or your breathing worsens, seek medical care immediately. Using your inhaler correctly helps the medicine reach your lungs and improves your breathing. Follow and subscribe PharmaWise for more trusted medication tips and easy-to-understand health education.